Welcome to The Explainer. Okay, so when you're in a hospital, you're putting an incredible amount of trust in the people and systems around you, right? Especially when it comes to the medicine you're given. Well, today, we're going to pull back the curtain on the amazing and, frankly, hidden systems that are designed to keep every single patient safe.
So let me start by asking you something. When you think about the risks in a hospital, what's the first thing that pops into your head? A complicated surgery, maybe? Or the risk of catching an infection? Just take a moment. What do you think is a top cause of preventable harm for patients, not just here, but all over the world?
You know, the answer is probably not what you guessed. And honestly, it's a little unsettling. It's not surgery, it's not infections. It's medication errors. Simple mistakes in how medicine is prescribed, handed out, or given to a patient, they represent a huge and often invisible danger in healthcare. To really get our heads around this, we have to understand just how big this problem is. We're not talking about some rare one-off mistake. This is a massive, system-wide challenge that healthcare professionals are fighting against every single day.
Now, what's really important to get here is that this is not about blaming any one person. Not the doctors, not the nurses. They're working incredibly hard. The problem is that the systems they work in are just so complex, and one tiny slip-up can have really serious consequences. So the goal isn't to point fingers. It's to build smarter, stronger systems that can catch those slips before they ever become a problem.
So how do hospitals actually fight back against this hidden threat? Well, they use a powerful, comprehensive safety framework. Think of it as a guardian angel for every patient. It's officially called the management of medication, or as we'll call it, MOM.
And what is MOM exactly? Well, you can think of it as the ultimate rule book for every single drug in the hospital. And it's not just a friendly suggestion, it's a strict standard. It covers the entire life of a medicine, from the second it arrives at the hospital pharmacy all the way to the moment it's given to a patient. And the main goals of MOM are actually pretty simple, but they are so powerful. It's all about preventing mistakes at every step. It's about making sure every medicine is stored correctly, that we're using drugs smartly and not overprescribing, and, this one is crucial, it's about making sure you, the patient, are educated and involved. Okay, so to see how this all really works, let's actually follow a single dose of medicine on its journey through the hospital. This isn't just a pill being dropped into a little paper cup. No way. It's like a precious package being tracked, verified, and protected every step of the way. This journey has 6 essential checkpoints, and each one is designed to close a loophole where an error could sneak in. It starts with making sure the hospital is even buying high-quality drugs from the right suppliers. Then it moves to storing them safely, writing clear prescriptions, double-checking them at the pharmacy, giving them to the patient correctly, and finally, following up to see how the patient is doing. It's a full circle of safety.
And here's what this looks like in the real world. Doctors use standardized guidelines so prescriptions are crystal clear. When the pharmacy fills it, they use barcode scanners for a digital double check to make sure it's the right drug. And storage? It's not just a closet. They do regular audits to check temperatures and expiration dates. And for monitoring, they have what's called ADR reporting. That's a system to instantly flag an adverse drug reaction so the whole team knows immediately if something's not right.
But you know, this whole system isn't just for the hospital staff. It's actually designed to empower you. Because in this entire safety chain, guess who the last and maybe most important line of defense is? You are. So you need to know your rights. You have the right to get the right medicine, and you absolutely have the right to know what it's for and what side effects to look out for. You have the right to speak up immediately if you feel something's off, and you always have the right to ask questions or even refuse a medication if you're not comfortable. Seriously, never be afraid to ask, "Hey, what is this pill for?" Your voice is a critical part of your own safety. Now, of course, no system is ever going to be absolutely perfect. Challenges pop up. The real goal is to keep learning and keep evolving. So let's take a quick look at how hospitals are tackling some of the classic problems with some really smart, modern solutions. You can see this really cool pattern here, right? For every old school problem, there's a new school solution. That messy doctor's handwriting that no one can read, that's being replaced with crystal clear electronic prescribing. Medicines being stored at the wrong temperature, that's being fixed with constant training and high-tech monitoring. And patients being confused about their meds? We solved that with one-on-one counseling and easy-to-read guides you can take home. In the end, it all boils down to this one single, incredibly powerful idea. The entire system is built to be proactive, not reactive. The point isn't to clean up messes after they happen, it's to build a process so robust that errors are found and stopped long before they could ever reach a patient.
So the next time you're in a hospital and you see that nurse scan the little barcode on your medicine, now you know. You're not just watching someone use a gadget. You're seeing a critical piece of a huge, life-saving safety system in action. And that leaves us with a final thought to chew on. What other safety systems are all around us in our everyday lives that are designed to stop mistakes before they can happen? Think about that. Thanks for joining us on The Explainer.